subscribers. I have got few comments in my comment section that I should tell about few diseases in English because few of my subscribers and my viewers are not comfortable in Hindi. So I am bringing this topic GERD in English also. This is gastroesophageal reflux disease. Now this is one of the diseases where it is present as a sign and symptom of a heartburn, that we have a severe burning sensation over the stomach and over the chest. This is and most of the time we find some acid material or the undigested food stuff, they come out through our nostril or the mouth when we are in the recumbent or when we are in the lying down position. So this becomes one of the very irritating and very uncomfortable situation when we suffer from GERD. So before explaining you about GERD, I would like to tell you something about the anatomy of our body and why this GERD is there. So just this is our food pipe or esophagus. This is connected to the stomach. So this is esophagus and this is stomach. So this is the direction of the food. You see the food travels from the esophagus, comes to the stomach. Here the digestion takes place. Then it goes to the small intestine, that is the duodenum. One thing is very specific in this area. What you find that there is one angulation is there over here. This between the esophagus and stomach, and this lower part is guarded by a sphincter called lower esophageal sphincter. This is a sphincter which is very important to prevent the gastroesophageal reflux disease, because whenever the food tries to goes from the esophagus to the stomach, sphincter relaxes and it prevents the food from coming back when it tries to come back, and prevents any type of reflux. So in few cases this angulation is changed and the sphincter becomes loose. In that case there is reflux of the acid leading to the gastroesophageal reflux disease. For medical student also, this is one of very important question that you get in your short note while you're taking your exam. So just try to describe the how this lower esophageal sphincter is formed and how it prevents the reflux of any gastric content. So in few cases where in the people who takes more of the oily and spicy food, who are very prone to the acidity and who are fond of eating more of the fast food, and in these people this GERD is very common. The people who are suffering from the gastric acidity, what you call, because of the repeated small amount of reflux, there is inflammation of the lower part of the esophagus called esophagitis. It leads to scarring of the area. It can lead to the bleeding of the area. In the prolonged cases can lead to esophageal carcinoma also if you don't take care of this lower esophageal GERD, that is the reflux disease. So it is very important that you should take care and manage this GERD. How you can manage this GERD at your home? First thing, you will have to change your lifestyle. That's very important. The important thing is that at night, don't try to try to avoid oily and spicy food, and take your dinner somewhere around 7 or 8 o'clock, so, or whatever time you take, but you should not sleep 2 to 3 hours after you take your food or dinner. Let this get digested and let the stomach empty. Let this propel to the small intestine, and that will prevent the reflux. And while you are taking your meals, try to take meals in a small amount. You can take your meal 6 meals in a day, but it should be small in the quantity. Don't take a large meal at any time. That will lead to acidity. Try to avoid the things which causes you acidity. Don't take such food which leads to the acidity. So in that case you can prevent. And while you are sleeping, try to sleep in the head up in the 30 to 45 degrees semi-recumbent position, so that you don't lie flat. You lie in the your head should lie like this, and there is some certain angle will be there. That will prevent the reflux. The reflex won't be there. So that thing is also. Now what are the medical management of it? You can the doctor generally prescribe antacids in the form of ranitidine or proton pump inhibitors. Then give you food propulsive drugs like levosulfide and cesapride. All these drugs are given. Then if you've got pain, then Hyoscine or Buscopan is given. So mainly the antacid is given to you to prevent, and the antiemetics, the anti-vomiting drugs can be given to you in combination with the PPI to prevent this gastroesophageal reflux disease. If it is not resolved by the medicine, the other mode of treatment is the surgery. So what actually we do in the surgery? I already told you that there is a esophagus. And this one angle is there, and this loss of the angle or sphincter become loose. What generally we do a surgery called Nissen's fundoplication, that is 360-degree wrap. What we do, if you say this is the say this is the esophagus and this is the stomach, so upper part of just upper part of esophagus, we wrap around the esophagus like this and take a sutures over here. So upper end of the esophagus is wrapped around the lower end of the sorry, upper end of the stomach is wrapped around lower end of the esophagus. So this wrapping of the stomach is there. So the stomach is wrapped around and a suture is taken. So stomach is wrapped around the lower esophagus. This is called. There are other surgeries. There's the Belsley Mark 4 surgeries, or 2-3 more surgeries are there. I'm not going to explain it. Common surgery is done is Nissen's fundoplication. So fundoplication is one of the surgery that is done for the GERD. Then nowadays this this fundoplication can be done by the open surgery or by means of the laparoscopic surgery. Nowadays through the endoscopy also we are trying to treat this GERD with a very successful result. I hope I am able to tell you or enlighten you about the GERD, and this they tell you the various method which you can take care and you can prevent this GERD in yourself. Once again, I'm thankful to you for watching my video and wish that all of you should stay healthy. And if you've got any comments, please, if you want to ask anything, just put it in my comment box. I will try to reply it as early as possible. Thanks for watching my video. Thank you very much. Thanks a lot.